Welcome to a digital tour on the Trust for America's Health Report on Reducing Teen Substance Misuse, What Really Works. Digital tours are part of the National Expert ATTC's suite of services. Trust for America's Health is a nonprofit, nonpartisan organization dedicated to saving lives by protecting the health and everyday community and working to make disease prevention a national priority. And I'm just going to take you through a brief tour of their report that they issued in 2015 on reducing teen substance misuse, what really works. Here's just a view of their table of contents, and you can see that the report is divided into 3 sections. The introduction, which focuses on youth and the increased risk for substance misuse. And also it discusses drug overdose since it has increased in prevalence in the last several years within teen and young adult population. And then the first section is devoted to understanding a public health approach to substance misuse. And they go over 10 specific indicators that can advance systems and organizations around reducing substance misuse. And then the final section makes conclusions and recommendations. The main hallmark of this report is that it emphasizes a public health approach to substance misuse, which focuses on a continuum of care, putting prevention first, focusing on the health and well-being of children and teens, reducing risks, and promoting protective factors, supporting screening for risk factors and early intervention, and providing comprehensive, effective treatment and recovery support for those who need it. One of my most favorite things about this report is the emphasis on risk and protective factors. And you can see that they review the risk and protective factors across the family or social support domain and outside the family. And this is a pretty solid evidence-based approach to thinking about youth and the risky situations, and also the supports and protective factors that we could emphasize in the young adult age, which will protect them into adulthood from addiction. And then the second part that I like is that it emphasizes the complexity of addiction and its roots in biology, the environment, and also the time and the availability of substances. So it really has a good in-depth explanation about the complex process that could potentially lead to addiction. Secondly, I really like that the report focuses on screening, brief intervention, and referral to treatment. And it also does a great job giving an overview of the expert billing codes, a breakdown by state, and a little explanation about what those codes mean and how they're being utilized in each state. The report gives 3 recommendations, and then it goes through 10 indicators that can bring these recommendations to life. The 3 recommendations are based on 30 years of science, and that is to emphasize prevention, early intervention and support, and sustained treatment and recovery. The 10 indicators are designed to support the 3 recommendations, and these are concrete indicators that states and their systems can actually work on to reduce substance use. And these are support academic achievement, prevent bullying, prevent smoking, prevent underage alcohol sales, implement screening, brief intervention, and referral to treatment, focus on mental health treatment, in particular focus on depression treatment, enact Good Samaritan laws, have emphasis on treatment and recovery supports for prescription drug misuse, and activate sentencing reform. So you really should check out this archived webinar in which the Trust for America's Health gave an in-depth overview of the report, and this webinar is archived on our website. Finally, you should download the report. This is the URL where you can find the entire report and also some additional information on the website. And we really encourage providers and organizations, state and local, to utilize it to advance prevention, intervention, and recovery support to reduce substance use in the youth population. It's an excellent resource, and I encourage you today to take a second look at it. Thank you.